Honestly, I was so shocked when I received the email that I was nominated for this award, and I was even more shocked when I was told that I was pulled for an interview, and instead it was actually the people telling me that I won the award. So I was just shocked because there's so many students at this university, and I think community health is such a small major and sometimes people don't even know what it is. So I was just really proud that a community health student was the one who won it, and I think it built up my confidence a lot in my work that I've done since I've been at KU. A big portion of the award is about academic excellence and usefulness to society, and I think that pursuing a career that is going to be helping people, I think that it's very important to understand that the occupational therapists are useful to society, but also understanding that like the work and the academic work that I've done at KU was recognized to one of the highest levels, which I think is just really, I was shocked. I also received the Tradition of Excellence Award from KU Endowment and the Senior Leadership Award through School of Health, Sport, and Exercise Science. I was just shocked, honestly, every single time, and I would text my family group chat and they were all like, oh my gosh, like this is crazy compared to just like there's so many students here, and I think that like I've always been somebody that's like work hard, play hard, and I have really, like I've held 3 jobs throughout college, I've been in clubs, and I never really was the person that I feel like made like the biggest impact. Some other people that have gotten the award, you know, started charities or created something that's being like patent pending, and I was like, I never did anything that, like, I guess, tangibly large or whatever the word is, but like, I think that I really found where I fit in and tried to make an impact as small or as big as I could in that little area. And that could just be making a connection with somebody in pre-OT club and giving them the hope that like they can go to OT school and that they have the resources that they need to do it. So I just tried to like find who I relate to the most and try to help them out when I could. And I think that was recognized more than I thought it would be, but I also got recognized for things that I didn't even really understand I was doing. I was just being myself. Senior spring of your community health degree, or I guess your last semester if you are in a faster, slower track than 4 years, is a full-time internship. So right now I'm at Britain Development Center in Lenexa, and it is a development center for kids with disabilities ages like 1 to 6. And I get to see, it's like preschool, but also integrated in is like occupational therapy, physical therapy, speech language pathology, aquatic therapy, feeding therapy, all mixed in. And they also do like special private sessions, and there's also peer models, which are students that are neurotypically developing that are in the classrooms helping be a model for our students with disabilities. So I've gotten to learn a lot about people with different disabilities and the range of disabilities, but as well how the interprofessional collaboration happens between all the professions in this field. The biggest thing, I was writing this in my final reflection for my internship today, was that I feel like my confidence was built a lot throughout this semester, both at my internship, but also with this award and another award that I received. I just feel like I was really recognized for the academic work, and I think that going into the first 2 years of OT school are all didactic classwork, and I have like a really big confidence going into that, knowing that I can attack it like head on and think that I can succeed doing it if I was able to like reach these honors at KU. I am going to be going to Boston University for my Doctor of Occupational Therapy, and it starts in September, so I'm really excited. I wouldn't trade it for the world. Like, it was so awesome. I think the coolest thing about community health was that we're such a small group, and I was in the same classes since middle of sophomore year, all the way up until now. The girls that are also doing their internships with me we meet twice this semester and got to chat about it, but we're also all really good friends and hang out and go out to dinner outside of this. So I think being close with all the people in the program has been super helpful. It doesn't feel like I'm always coming to class. It feels like I'm hanging out with my friends, but also the professors were just amazing. Like Dr. Collins and Dr. Harvey and Jenny McKee like really just worked so hard on each and every one of us and cared so much about each of us that it made just a program so special.